Hello, my name is Dr. Stephen Mulholland. I'm president and founder of Spermatic. Spermatic has been around serving the Greater Toronto community out of Yorkville for 25 years. One of the fastest growing elements of our business here at Spermatic in the past few years has been the number of women presenting for treatment with vulvovaginal or vaginal rejuvenation requests. And a lot of that has to do with really the renaissance in our non-invasive technology. We treat four main clinical syndromes or concerns. They are stress urinary incontinence, vaginal laxity syndromes, vaginal atrophy or atrophic vaginitis, pain, discharge, sensitivity, and dryness. And the last is labial hypertrophy or enlarged labia minora, women presenting for non-surgical labial reduction. Those are the most common four clinical syndromes that have really grown over the past 5 years because we have great technologies to treat them. The benefits of some of our new technologies to treat the big four syndromes that we see, stress urinary incontinence, vaginal laxity, labial hypertrophy, or vaginal atrophy and stress urinary incontinence, are that these are non-invasive treatments. They can be done as an outpatient in the medical spa, typically one treatment a month for 3 months, and we can make significant improvement in stress urinary incontinence. We can rejuvenate the vaginal atrophic floor, so there's less symptoms of vaginal atrophy. We can improve vaginal laxity syndrome, so there's more fulfillment and competency during intimacy. And we have non-excisional technology to actually shrink labia hypertrophy, so you don't need to undergo surgical labia reduction surgery. The best time to get some of these vaginal rejuvenations or these vulvovaginal perineal rejuvenation procedures at Spermatic is when you are done childbirth. If you're still in childbearing years and you're having normal vaginal delivery and non-C-section delivery, you're going to distort some of the anatomy, you're going to cause some trauma, and so I would wait until your childbearing years are over. And if you suffer from a degree of SUI or stress urinary incontinence or vaginal laxity issues, or you've got labial hypertrophy, we would seek treatment then. Typically, the technologies we deploy are intravaginal and non-invasive. They're innovations by a company called InMode, and they have very gentle applicators that can introduce into the vaginal canal to tighten the pelvic floor, to rejuvenate the lining of the vagina, to improve the stiffness around the middle third of the urethra so that you don't have stress urinary incontinence, that you have a more competent vaginal vault, that you don't have the symptoms of vaginal atrophy, that you have healthier lining of that vaginal canal. And we can also shrink the labia minora non-surgically. And all of these technologies are done as outpatient in the medical spa, very little downtime, and usually you can be back to work that next day. Typically it's going to be a series of 3 treatments once a month for 3 months to get the best possible results for all of these syndromes. But typically we can improve somewhere between 50 and 90% of your symptoms, no matter what your clinical syndrome is, after a series of 3 non-invasive vaginal rejuvenation treatments. There are alternatives to non-invasive vaginal rejuvenation. The InMode Votiva platform that we have helped develop here at Spermatic with the Forma V, the Morpheus V, with the EMS system, with the Accutite and the Aviva for labiaplasty reduction are very, very iconic and very advanced applicators. There are very few other devices that would compete with that. There are surgical treatments, of course. Surgical labiaplasty for the excision of enlarged labia, anterior-posterior surgical repairs for vaginal laxity, certain surgical slings for resuspending the urethra, but all of these are invasive. They do give improvements in stress urinary incontinence, vaginal laxity, and they do reduce the labia, but they all need surgery with some recovery. Hence the popularity of our Spermatic Vaginal Rejuvenation Program. No surgery, very affordable, no real downtime or recovery, and good results. Hundreds of women have chosen Spermatic for their vaginal rejuvenation care because we have the most technology in the single center with the greatest amount of experience, ensuring that the right technology is used for the clinical concerns that you have, be them functional or aesthetic. Over the years, I've done a number of educational television shows that outline and explain some of our vaginal rejuvenation technologies. Let's take a look.
It is the second fastest growing cosmetic procedure in the U.S. and now clinics right here in Toronto say that labiaplasty is on the rise here too. More and more women willing to shell out thousands of dollars for so-called designer vaginas.
I said, why not? I'm going to treat myself instead of buying a new car or, an expensive purse. Then just, do a surgery.
35 minutes is all it took for this mother of two to get an instant boost below the belt.
I wanted to get it done because I have 2 kids. I've been waiting a long time, and I have a new boyfriend, and it's nice to have it back to original state.
What is a labiaplasty?
Labiaplasty is a fancy term for sculpting or changing or altering the shape of the labia majora, the outer lip, or the labia minora. Either make it smaller, which is by far the most common, or bigger, which would be labial augmentation.
Dr. Stephen Mulholland says he's seen a 100% increase in women requesting labiaplasty in his Toronto clinic in the last 3 years.
The ones that want labia reduction, plumping, augmentation, G-shot, they tend to be millennials. The women that want laser vaginal rejuvenation tend to be more postmenopausal, 50 plus.
However, concerns remain over women seeking drastic plastic surgery in pursuit of perfection.
If this isn't a decision that she's made for herself, then certainly it can be problematic. However, women, we should be allowed to do whatever it is that we feel is best for our body.
Anna here says the decision for her lower body lift was all her own. Would you say it improved your self-confidence?
Yes, for sure. There's a little discomfort when you first do it, but it goes away. And it definitely will make your sex life a little bit better, for sure.
Here in Toronto, the wait time for labiaplasty can be up to 4 months and can cost a patient anywhere between $2,500 and $5,000 for a so-called designer vagina. In Toronto, Amanda Ferguson, City News.